This study was important because HIV pre-exposure prophylaxis is really going to be key to us ending the HIV epidemic. So having more options for patients, allowing clinicians the opportunity to discuss these options and choose drugs or methods of prevention that are most appropriate for the patient in front of them is really critical. So for this study, we designed a more than 5,000 patient study. It was a 1-to-1 randomization with a placebo, an active control and a non-inferiority study design, meaning what we were really trying to ask is Descovy non-inferior to Truvada, the only drug that's currently approved for PrEP? And we were able, in fact, to determine that it was, in fact, non-inferior. Well, I think the main take-home message for PrEP is that it works. So both of these drugs actually performed very well in this study and offered extremely high degrees of protection against HIV infection in high-risk populations. And I think that really is the main message that I take home. It's also important to know that we now have options for PrEP. So it's not a one-size-fits-all situation anymore. We do have medications now that we can choose from and tailor the individual treatment that we're using to the patient that's in front of us based on their individual profile, their risks, their concerns.